The question is, I am a newlywed and I'm struggling to communicate to my husband that sex is either numb or painful for me. What should I do?
First off, thanks for your courage to write in and ask. It takes a huge amount of courage to cross that line and say, help, this is not what I expected.
Hmm.
What is going on? How do I meet this need? I have no idea. So thanks for that. Um, this is more common than you might think. You're not alone. Once again, the first thing I would want to notice with you is to say, you know what, if there's an area that you're experiencing pain, it's okay to stop. One of our wonderful trainers has a great phrase that I just use all the time. It's like, we don't play through pain. That's actually not the purpose of sexual intimacy. When you are in that close relationship, it is emotional as well as physical. You're not going after one physical experience, right? You're going after closeness and connection, and pain impacts that closeness and trust. So feel free to say, no, thank you. Wait, we got to stop. We got to stop if there's pain. Okay. It's not a push through until it stops moment, because that can kind of injure the relational trust that you're building, especially in
Mm-hmm.
this early time in marriage. Okay. So, the other thing we would really want to encourage you to do is to notice what kind of pain it is. There's a lot of different things that people grow up with as a culture, either talking about or not talking about, as far as understanding their own anatomy, men and women both. In church cultures, sometimes we don't have a lot of good dialogue around understanding women's anatomy and what things mean different things in sexual intercourse.
Mm-hmm.
So I would want to invite your listener to um, pause and start to get curious about what kind of pain her body is actually experiencing, what kind of numbness, and what location, because that can actually tell us a lot about what the issue may be. She can notice things like, is it a burning? Is it on the actual skin of her anatomy? Is there a location in her vagina? Is it inside of the walls of her body that she notices those sensations or tension? Sometimes it can be something like an irritant. Newlyweds are, merging households, and you use this fabric softener, I use that kind of fabric softener, I don't use any. Sometimes it's really simple topic, like she has a skin irritation that from a new kind of chemical that's present. Be that as it may, getting curious about what the actual response is for her body determines the course of treatment. So strengthening her voice to be able to say, this doesn't feel comfortable, I need to stop, is really important. But getting curious about where the pain is located and what kind of pain will also help determine what that is. Um, Not as a pure course of treatment to say, now go do this and it's going to fix everything. But there's some things she can do, as well as talking with her doctor. She needs to bring some information to her doctor to help him understand how he can help her. So if she takes some time and uses her own fingers after, say, a warm bath to explore, what are the sensations that are here for me? Is there other kinds of muscle pain that I experience at just touch? She can bring that information to her doctor, and he can also help her understand a little bit more if there's a physical nerve connection going on, if it's a tactile something, or if it's an emotional process that she's processing with her spouse. It's unique to every person, but those are some simple things that she could begin with to speak with her doctor, and maybe even if he could refer her to sometimes a pelvic floor specialist or a counselor, depending on what her background is and what she discovers about that kind of pain or numbness. Um, can I give a quick word about numbness? You
Yes,
have time for
please.
that? Okay, so quick point to notice, especially for newlyweds. If this is her first sexual encounter, um, it may be that her body, when she experiences numbness, is experiencing overstimulation. Like, God created our eyeball with a really specific environment. It needs to be clean. It has different types of irritations that affect it. It's no different from the female anatomy. The clitoris has certain kinds of stimulation that provide different kinds of pleasure for it. If there's too much stimulation, it can mean that that numbness kind of takes place. It's overstimulated. And she may be able to notice that numbness kind of stops after stimulation stops. So, cleanliness and gentleness for both parts of you, understand your body as God made it, that they're all unique. Every piece of your body is unique and requires unique care. We kind of want to pull those layers of shame sometimes that come with understanding what's going on with our body, and that it has a unique care process for it. So just as an encouragement on the piece of numbness, that may help with understanding, well, just slow down, stop stimulation for a minute or two, and it may actually come back to some sense of pleasure for her. Again, just strengthening her voice, letting her spouse know, this is what I experienced right here, right now. Okay. Does that help a little bit?
Yes. I mean, I took some notes. Don't play through pain. I mean, we could use that in in all aspects of our life. And again, we're back at expectations, setting the expectations. Probably a key to life.